All right, dear students, today the lab will be about the blood. So we are going to do those review questions together. What is the blood volume for an average adult size, where the male have more blood volume? It's about 5 to 6 liters, and the adult female is about 4 to 5 liters. And what and depend on the degree of oxygenations. The more oxygen carry is in the blood, the brighter red is the blood. So the most numerous leukocytes are four white blood cells. And the erythrocytes, site mean cells, by the way, are the red blood cells. They are, sorry, they are anucleate formed element. Those are all formed elements of the blood, okay? So the erythrocyte, as I said, they are between, they transport oxygen and carbon dioxide, right? Leukocytes are the white cells. The most numerous leukocytes are the neutrophil. You cannot miss the histology for neutrophil. The nucleus is multi-lobed, and they are granulated. They have like three type of granulation, granulated leukocytes. We have the neutrophil, eosinophil, and basophil. As you can see, the lymphocyte and monocyte, they don't have granulation, those little dots inside of their cytoplasm. At the point, like those dots, they are so numerous in the basophil that they completely, what I said, completely obscure the nucleus. And the nucleus for basophil is a U shape, but you cannot see it. There are so many granulations on it, so you cannot miss the basophil. Eosinophil are large. They represent about 1 to 4% of the white blood cells. We're here 2 to 4%. That's okay. And they are either figure 8 or bilobed the nucleus. Like you can see here, it's two lobe. You see the neutrophil have multi-lobe and granulation. Eosinophil is also granulated, but it's only bilobed, two lobes, and they represent, neutrophil are the most abundant. I said between 40 to, well, here it's 50 to 70%. And neutrophils are, the eosinophil are between 2 to 4%, and they are either figure 8 or bilobed nucleus, and they are granulated. Basophil, we explain it. Our nucleus is lobed. It's in shape of U, but it's completely obscure, but so many granulation inside of the cytoplasm, and they are the less abundant. They represent less than 1% of the of the total white blood cells. Lymphocyte, as you can see, lymphocyte is a very big spherical nucleus, and you can see the cytoplasm in light blue around it. They represent, the lymphocyte represents between 20 to 45% of the white blood cells. The monocyte are represent between 3 to 8%, and they are kidney shape, the nucleus, or U shape is a kidney or U shape. All right. And they have some anomaly associated, because actually broadly speaking, a hematologic study of the blood are very important on diagnosis of some diseases, because specific changes from normal number, type, or form elements and or plasma constituents are characteristic of some certain disease stages. So let's see, for example, in your question, They have a table over here. But before I go to these questions, let me tell you, abnormal increase of the number of white blood cells, that's mean leukocyte. It's called leukocytosis. There are so many lyses of the production of the white cells. This is leukocytosis. Increase of the number of red cells, it's polycythemia, and less blood cells or less hemoglobin deficiency. That means doesn't have the patient does not have enough oxygen. This is anemia. Abnormal decrease in the number of white cells. This is penia. This is leukopenia. Okay. So the most abundant, I said, the mirrors as leukocytes. The granulocyte cells, you see there, eosinophil, basophil, neutrophil. The phagocytic leukocytes are the monocyte, neutrophil, and eosinophil. Megakaryocytes are the precursor of the cell platelets. The eosinophil is involved in destroying the worms in the body, the parasitic worms. The basophil are involved in allergy, release histamine, and promote inflammation. Lymphocytes produce antibody. The red blood cells will transport oxygen. The plasma is made primarily of water. They don't have any cells, no cellular, and this is the fluid matrix for the blood. The monocyte can exit actually the blood vessels to develop into a macrophage. All right, and okay. What else we can talk about on here? So as I said, the differential count determines the relative percentage of each white blood cells. Its increase or decrease in specific white cells or population are often indicative or diagnostic of specific pathology. So let's look at those normal level and when they are not normal or outside of their normal range. It caused some disease, so I want to see those tables. We come back to the hematocrit later. This is very important. We come back to this also. The blood type. I want to go to the review. So here you can recognize immediately which type of this. As the first ones are, you name it. This is neutrophils, right? The next one is lymphocyte, right? The other one is, you see the form 8. No, this one is the monocyte. The next one is a form 8, figure 8, beloved nucleus. So this is eosinophil. And the last one, there are so many granulations that you cannot see the U shape of the nucleus. This is basophils. Okay. Yeah, this is what I'm going to talk about. This is the, I mean, the total white blood cells count in normal value, healthy male. You can look at those data in your lab. That's between 4,000 to 11,000 per cubic millimeters. If it's high, that means this patient is suffering from infections or metabolic disease, hemorrhage, or some poisoning. If it's less, decreased body protections, they have some chemical toxicity or some disease states. The total red blood cells between 4 to 6 million per millimeter squares. High value mean polycythemia, all right? We already look at this. Polycythemia mean an abnormal increase in number of red blood cells, all right, due to high altitude of pulmonary disease. Low level mean anemia or bone marrow cancer. The hematocrit should be between 42 and 52% as volume. High level mean polycythemia, right? Dehydrations, congestive heart failure, shock or surgery, less, well, it's going to be less blood cells, all right, red cells. So it means anemia. Hemoglobin determination between 13 to 18 gram per 100 milliliters of the blood. More hemoglobin mean polycythemia or dehydrations. Less mean anemia, deficiency in iron, and therefore deficiency on hemoglobin. Bleeding time, this is between two, I mean, it depends, uh, it's usually between 2 to 7 minutes. More than that, this is deficient on abnormal platelets, because the platelets are involved in the coagulations. But if it coagulates quicker, I mean less than 2 minutes, that's mean high platelet count. Coagulation times, it's between 2 and 6 a minute. So higher than that mean hemophilia, leukemia, increased clotting time, and less than that, it's mean thromboembolic disorder. So a differentiate, as I said, differentiate can determine the relative percentage of each type of white cells. Increase or decrease mean it's indicative of specific pathology. So the process to produce red blood cells, it's called erythropoiesis. I really want you to look at that. And the precursor, I want you really to look at that. And I mean, the hormones that act as a stimulus for this process is erythropoietin, and this erythropoietin is produced by the kidney. So this is why patients with kidney failures suffer from anemia, because when the kidney fails, they also do not produce enough erythropoietin, therefore did not cause erythropoiesis that produce enough red blood cells, and therefore those patients with the kidney failure suffer from anemia. And we can reverse that by treating them with genetically engineered fabricated erythropoietin. Hematocrit, I mean, this is mean it's the packed cell volume, the percentage of total blood volume occupied by red blood cells. Long-term effect of athletic training. I mean, this is very nice. When you run 4 to 5 miles per day or a period of 6 to 9 months, you develop a large muscle mass that need an efficient oxygen delivery to the muscles when they are working. So an increase in red blood cells between a move from a sea level to high level altitude area is that the air in the high level altitude is thinner and contain less oxygen. So the body compensates by producing more red blood cells so that the same relative amount of oxygen can be picked and transported by the blood. So this is a permanent move from the sea level to the high altitude level, and this is why sometimes your nose, bleed. If you have high hematocrit, what's that mean? That means you have high hemoglobin determinations. Why? Because assuming the red blood cells have a normal hemoglobin content, the higher level of red blood cells volume, the higher the hemoglobin determinations is. What is an anticoagulant? An anticoagulant is an substance that inhibits blood clotting, and we have a naturally produced one by our body. It's the heparin that exists in the capillary tubes, and we have also the EDTA. So let's move to the blood type ABO. If your blood agglutinate, if your blood agglutinate or clumps with an anti-A and anti-B serum, he coagulate or clump with an anti-A and an anti-B serum. That means you have both antigen A and B. So your blood type is A and B. To what ABU group you can give your blood? Only to A and B. Okay? A, B. Sorry, no, not A and B. A, B, which is the less common blood type. The more common blood type is O, which is also the universally donor. But if you are group AB, you can receive blood from A, B, and O. You can receive it from all of it. So you are the universal receiver, even if you are the less common, AB. Okay? Why is the always the O negative is the universal donor? Because the red blood cells have no A, B, and rhesus antigens on the cell membrane, so therefore they reduce the chance of transfusions, reactions, or agglutinations or blood clump. Okay, in contact of other blood cells. So let's look at your first one, Mr. Adam. Mr. Adam, blood drop and antiserum A, no agglutinations, but I saw an agglutinations with the blood drop and an antiserum B. All right. So that means he have a B antigen, right? So therefore the blood group is a B because it doesn't agglutinate with an anti-A. That means it does not have an A as an antigen, but it agglutinate with an anti-B. That means you have an antigen B. Therefore the group here is a B. The other one does not agglutinate with an anti-A. That means does not have an A antigen, does not have an B antigen. Therefore is an O for Mr. Canhon. Okay. So next, why the rhesus negative does not have transfusion reactions on the first exposure, and this is a case actually with a female married rhesus negative married male with a rhesus positive. The only reason is because no spotodyes may form a rhesus antibody in his or her blood after the first exposure. The rise to a rhesus positive blood, the immune system reacts and then start making antibodies. And then they want you to use this slide view. I mean, look at this slide and tell us, you are just going to imagine virtually you are looking at they gave you this disease, macrocyte hypochromic anemia. Macro mean large, and anemia have to deal with red cells, so for sure they have the red cells should look larger. All right. The other one is microcyte, and this is an anemia also. So immediately this is have to deal with red cells, and this is micro, so the red cells are smaller. Sickle disease, the red cells doesn't have the normal structures. Remember I told you like it's like a donut hole. This one are the sickle disease cells, and anemia red cells are a crescent shape. Lymphocyte leukemia. Lymphocyte leukemia, large number of small abnormal lymphocytes, and eosinophilia, an increased number of eosinophils. So now we are going to correspond the following, those slide to the following conditions. Iron deficiency diet. So it's immediately, this is less blood cells. So this is a B, microcytic hypochromic anemia. A type of bone marrow cancer, that's going to be the leukemia, the lymphocytic leukemia, D. A genetic deficit that causes hemoglobin to become sharp and spiky. That's mean that does cause a normal shape of the red blood cells. That's a sickle disease, which is a C. A lack of vitamin B12, well, lack of vitamin B12, that's mean the red blood cells are large. This is a macrocytic hypochromic. Tapeworm infections in the body. That's mean eosinophilia, which is E, and bleeding ulcer. Bleeding ulcer mean they are hemorrhage over here, so less blood cells. So this is a B, which is a microcytic hypochromic anemia. The larger, I mean, the cholesterol is between 130 to 200 milligrams per milliliters, and well, I don't want to talk a lot about the cholesterol things. It's just like the LD, a high level fiber cholesterol uptake and deposit in arteriosclerotic plaque, which in turn first narrow the vessels, reducing the blood flow to more distal tissue, and second, can increase the risk of thrombus formations. So narrowing, I mean, making the blood vessel small in diameter is one cause of hypertension. Okay, so this is why I don't want to talk about this. All right, so that's end our blood labs for today. We will talk tomorrow about the heart, anatomy of the heart and the physiology of the heart. So see you tomorrow for another lab. Thank you so much. Bye bye.